Yeah, there would be different scenarios where, it could be, so I told the story of our first patient we had with Origin, because she actually reflects. So, a
Okay.
patient who came in struggling to breathe, she was diagnosed with a heart failure exacerbation. They said, you need to be admitted for treatment. And she said, I can't. She has an adult son at home. His mental health treatment means she has to give him his medicines. And so she said, if I end up in the hospital, he'll get worse. The cops will be called. I can't do this. And so here's someone that was
Mm,
sacrificing her own health. She wanted to get better, but we
mm,
weren't giving her options to do
mm,
that. We would
mhm,
have people in the hospital who, separated from their loved ones, would have a lot of anxiety and depression.
mm,
They'd be in the hospital, other patients would come in, and because unfortunately people don't get up and move around as much in the hospital, now all of a sudden they need a nursing home. And when they came in fully ambulatory, we've had patients who left against medical advice because their pet was home and there was no one to take care of them. I just kept seeing that there was all of these situations where we weren't providing patients with options. I describe it as like we had created this binary system in healthcare that you're either inpatient or outpatient, then there's nothing in between.
mm.
And really felt like there was this opportunity, especially because the literature and people doing this overseas for decades, there is this new wedge of healthcare. It doesn't need to be inpatient or outpatient. We can create this new space where you're getting inpatient level care in the comfort of your home and do it much better. And so that was, for me, transformative to say, this has to be something where we can really meet our patients' needs, decide what they need, and then build the support system around them instead of, basically anchoring them to a facility and then building the needs around them. It's not what it, and then we know like access is such an issue for people, rural communities don't have hospitals that they can go
Yep,
to and are driving hours.
yep,
People
yep.
of different socioeconomic backgrounds have been, unfortunately, not treated well in the healthcare
Mm,
system before. And so they'll put
mm.
off getting healthcare until it's really too late. Now they're in the intensive care unit. So we really felt that there was a space to create options that really met the needs of patients better and opened up that opportunity for them to get the care when and where they need it the most.
Yeah, I would just assume, and I'm not an expert on it, but I would assume almost not every, like 80% of the patients you would see in the hospital, they're always saying, Christine, when can I go home? When can I go home?
Yes.
When can I go home? When can I go home?
Yes.
When can I go? It's
Yes.
constantly, constantly.
Yes. And because technology has really advanced. So my co-founder, she worked in the cardiothoracic ICU at UCLA. And when we were taking care of some of our first patients, she was used to these super intense on ECMO, multiple drips. We're seeing these patients, and she was asking me, she's like, would these patients be in the hospital? And I said, yes, unfortunately, a lot of these patients in the medical unit are getting once a day antibiotics, once a day labs. And then for 23 hours, they're sitting in a super expensive bed, isolated from their family, at risk of infections.
Mm,
The hospital, unfortunately, we need hospitals, but it's not a benign place for people. Infections happen, adverse events
mm,
happen. And
mm.
so, that's what was so intriguing about this model is this model had been rigorously studied. And by every metric that we cared about in healthcare, all of those quality metrics and safety metrics were better when patients got care in their home. Mental health scores were better. And then the key for me was the cost of care was 30 to 40% lower. So it's like
Okay.
we have the
All right.
four-leaf clover of healthcare, like literally in front of us.